Cancer affects millions worldwide, yet its early signs are often misunderstood or ignored. The sooner you catch and treat cancer, the better your chances of beating it. Here's a list of 8 symptoms you shouldn't ignore. Being aware of these could really save your life. This is the second video in the series. If you haven't watched the first one, make sure to check it out after you finish this one. It's packed with useful information that you won't want to miss. Let's get straight to it. Number 1, a cough or hoarseness that won't go away. If you're dealing with a cough or hoarseness that just won't quit after more than 2 weeks, it's time to see a doctor. A stubborn, dry cough that won't let up could be signaling lung cancer. Alarmingly, coughing up blood or experiencing a bloody discharge is an urgent sign requiring immediate medical attention. Similarly, a persistent raspy or strained voice might also be a telltale sign of trouble. If you're noticing changes in your voice paired with difficulty swallowing or pain in your neck or throat, these symptoms could point to thyroid or throat cancers. While it's easy to dismiss a lingering cough or hoarseness as nothing serious, these symptoms can actually indicate deeper health issues. Pay close attention to what your body is telling you. Persistent respiratory symptoms should never be ignored. If your cough or hoarseness stretches beyond a couple of weeks, don't wait. Get checked out by a healthcare professional to get to the root cause and get the necessary treatment. Number 2, changes in urinary or bowel habits. Changes in your urinary or bowel habits can signal an alarming alert that something is off in your body. Experiencing constipation or diarrhea that persists for several weeks? Time to visit the doctor. These symptoms might seem minor but could point to serious underlying issues, including cancer. Altered bowel habits might indicate inflammatory bowel diseases like Crohn's disease, but can also be signs of colon or stomach cancer. Such cancers disrupt your digestive system, causing significant changes in your bathroom habits, affecting both frequency and comfort. Similarly, changes in urination, such as painful urination, increased frequency, or a weak urine stream, could indicate problems like an enlarged prostate, urinary tract infections, or, more critically, prostate or bladder cancers. Being proactive about your health involves heeding your body's alerts. If you detect any lasting changes in urinary or bowel habits, don't delay. Consult a healthcare provider. Number 3, new or unexplained pain. If you're suffering from pain without a clear cause or relief from standard treatments, it's a signal to see a doctor immediately. Persistent pain without an obvious reason could be a warning sign of cancer. For instance, abdominal pain in men might suggest the presence of prostate, bladder, testicular, or penile cancer. In women, unexpected pain or tenderness in the breasts could be indicative of breast cancer. This type of pain doesn't subside with common treatments and may point to something more severe. Additionally, pain can signal internal cancers. For example, a constant sensation of heaviness or swelling in the scrotum might be a sign of testicular cancer. Chronic pain in the abdomen could also be a symptom of serious issues like liver or pancreatic cancer. Such pains are frequently ignored or misattributed to minor causes, yet they deserve serious attention. When it's persistent and unexplained, it demands medical investigation. Number 4, persistent fatigue. Persistent fatigue might be an early warning of cancer lurking in your body. If you find your energy levels have crashed and no amount of sleep or rest makes a dent, it's crucial to take note. This isn't just your regular tiredness from a packed schedule. It's a profound, relentless drain that could hint at cancers like leukemia or lymphoma. These cancers attack the blood and bone marrow, messing with your body's ability to pump out healthy blood cells, leaving you exhausted no matter how much you rest. Beyond fatigue, you may also feel muscle weakness or experience confusion. These issues could link to cancers affecting hormone levels or causing internal bleeding, such as colon or stomach cancer. When cancer interferes with your body's normal operations, it leads to constant weariness along with other concerning symptoms. Yet, if your exhaustion remains unexplained and continues over time, consulting a doctor is essential. Number 5, persistent headache. A relentless headache that defies over-the-counter or prescribed medications is a red flag. If you're grappling with a headache that just won't quit after more than 2 weeks, it's crucial to consult a doctor. This type of persistent headache may signal something far more grave, such as a brain tumor or other types of brain cancer. Accompanying this headache, you might encounter additional neurological symptoms, including blurred or double vision, hearing changes, or facial drooping. Experiencing these symptoms along with your stubborn headache means it's time to get checked out immediately. Brain tumors can exert pressure on nerves and disrupt standard brain functions. Early detection is key in managing and treating brain tumors and associated conditions effectively. Pay attention to what your body is telling you. If your headache persists with other neurological signs, don't hesitate. Seek medical help right away. Number 6. Blood in the urine or stool. Blood in your urine or stool should never be overlooked. If you're spotting it, this can be a serious concern. Whether it's black, tarry, or bright red in your stool, or pink, red, or dark brown in your urine, these symptoms could suggest severe conditions, including various cancers. Blood in the stool is often linked to digestive system cancers like colon or rectal cancer, and might also indicate inflammatory bowel disease or ulcerative colitis. These diseases can disrupt your digestive system's normal operations and cause bleeding. In the same vein, blood in the urine might point to prostate or bladder cancer, as well as infections or other issues within the urinary tract. The appearance of blood is a critical signal that something isn't right within your body and demands immediate medical attention. If you detect blood in your urine or stool, seek medical advice without delay. Don't take risks with your health. These are warning signs you can't afford to ignore. Number 7. Mouth sores that won't heal. Mouth sores that linger beyond a couple of weeks need urgent attention. If you're noticing persistent sores, lesions, or white patches on your lips, tongue, gums, or other parts of your mouth, it's crucial to get them examined. These could be signs of oral cancer, which can occur anywhere in the mouth, including the lips, tongue, and throat. Risk factors like tobacco use or heavy drinking can increase your chances of developing this type of cancer. Don't ignore persistent mouth sores, especially if they're accompanied by symptoms like difficulty swallowing or unexplained weight loss. White patches, known as leukoplakia, are particularly concerning. While these may seem harmless, they're a precancerous condition that could evolve into cancer if not treated promptly. Get these patches checked by a healthcare professional to decide the best next steps. Overlooking mouth sores can have serious outcomes. Oral cancer is a formidable foe, and catching it early is crucial for effective treatment. If you're dealing with non-healing sores, don't delay. Seek medical advice immediately. Number 8. Excessive bruising. Excessive bruising, especially in unusual spots on your body, could be signaling certain blood cancers. If you're spotting bruises without any obvious reason, it's crucial to consult a doctor. Such bruising can be symptomatic of issues with your blood cells, potentially pointing to leukemia. Leukemia disrupts your body's capacity to generate healthy blood cells, which can manifest as excessive bruising. You might find these bruises on your arms, legs, or other areas where they typically wouldn't appear. Don't overlook this symptom. It might be the early warning of a serious health condition. Alongside bruising, other signs like frequent nosebleeds or bleeding gums could also suggest blood disorders or cancers. If you're experiencing any of these troubling symptoms, it's essential to get a thorough checkup. Cancer can occur in various forms, and spotting the early signs is vital for timely intervention and treatment. Always listen to your body and consult a medical professional if you notice any concerning symptoms. Thank you for tuning into this video. If you found it helpful, please give it a thumbs up and share it with others who could use this information. Don't forget to subscribe to our channel for more valuable health content.